Dry needling is a technique used to treat dysfunction in skeletal muscle, fascia, and connective tissue. The technique is used to reduce active trigger points, which are hyper-irritable spots in a taut band of the skeletal muscle that are painful on compression, stretch, overload, or contraction of the tissue. They are caused by repetitive muscle overuse, acute sustained overload, or even psychological stress leading to a spontaneous EMG activity. Dry needling can help relieve pain significantly by directly targeting trigger points. It reduces nociceptive input and reduces widespread pain by firing nerve fibers that stimulate your brain to release endorphins, which are your body's homemade pain medications. Dry needling will release this trigger point with eliciting a local twitch response, which will help with the deep muscle relaxation, reduce stiffness, and improve flexibility. Benefits can be seen with increased range of motion as soon as the procedure is completed, making straining activities easier to be performed. Trigger points provoke motor dysfunction such as muscle weakness, inhibition, and increased motor irritability, spasm, muscle imbalance, and altered motor recruitment. Dry needling will help normalize correct muscle function to aid recovery from injuries and strains. When your muscle is overused, it goes into an energy crisis where the muscle fibers aren't getting an adequate blood supply. When they don't get enough blood supply, they don't get enough oxygen and nutrients to allow the muscle to go back to its normal resting state. When this happens, the tissue near your trigger point becomes more acidic. Your nerves are sensitized, which makes the area sore and painful. Stimulating the trigger point with the needle helps draw normal blood supply back to flush out all the area and release tension. Contact a trained physical therapist at Freedom to see if you are a candidate to benefit from dry needling.